And that's him. So you can see the chin was way too protrusive, and this angle was very steep. The lip was inside, and this height, the vertical height, was not appropriate. Was a little bit less. All right. So we did our scans, we did the planning, and now you can see him intubated here. And this is like it says 12:55, so it's 1 hour before. And we're going to show you what exactly we did. This is uh, sorry about that. I'm just going to get back to the yes. So this was how the chin was after we exposed it. And I think if you see carefully, you can find out the two corners, like two projections that you see. So that was the reason why the chin was looking overtly projected, right? So if we start from there, and that's the planning. So I've designed the osteotomy posterior and inferior to the nerve, retaining the cornu at this point in time. What you see in the background is our anesthesia and the team extubating the patient while we're going live here on. So that's how it was. And then we make the osteotomy cut, and this is where we landed. So if you see now carefully, there's a gap that's left between the two osteotomy segments, which is where the augmentation will happen. We've also altered the angulation of the two osteotomized segments, fixed it with 2 plates and 4 screws, giving the desired aesthetic result that patient is seeking. Right? We're going to show you some more in different angles. You can appreciate in this how the chin's projection in the horizontal dimension has been reduced significantly, and how we've augmented it by 6 mm. The gap that you see, it's all going to get filled up with blood and then eventually get to new bone. So that's a good thing. And this is permanent, and this is for life. You can also see this short video because I'm going to show, I just showed them how much of augmentation we've done, how much of reduction that has been done, and how it has been done. So that clearly shows you that's about 7 millimeters. That was a plan. So that's to redrape the chin to see if everything was okay. No asymmetries. They like the shape, they like the way the soft tissue is adapting to the newly contoured, newly positioned chin. This guy is in his early 30s, is he? Yeah, he's in his mid-20s. So we want to give him a nice chin, not like a witch's chin. So all the alterations done. All right. There's still some video left. You probably want to see this because we're going to be comparing after this video is over. Okay. All right. So we move from there to what you saw just now. So if you have any questions or anything, we're more than happy to answer them. Are there any questions? Yeah, there are a lot of patients who ask me about what's the difference between a chin implant, which probably can be done much more easily. But as I mentioned even in this video, the amount of contouring or reshaping or getting the chin in both the dimensions is really far superior with this kind of surgery than with any implant that you can ever think of, because that's just going to be an onlay. Here we're making the cut, we're moving it. Also the muscle attaches well with bone, so you get a normal moving anatomy around the chin and the lips. There's nothing that looks odd or bad or artificial or not natural. So I think these are the reason, and it's for life. And it also gives you benefits of getting the double chin corrected if you have any. It gives a better airway, and there's no scarring. Thank you. What's that? Am I just going on live now? Ah. Okay, so double check. You want to do a trial? Let's take a trial.
It was going live here on
I
YouTube.
know. So yeah, hi all. This is 2-1. If you have your questions, just shoot them down. I thought it was online a few minutes ago, but then I just realized it was on YouTube and not Instagram. So now I'm live on Instagram. And we had a very interesting surgery. Just finished with that. The timing was a little bit not so perfect because they haven't extubated the patient. You can see in the background a team they're extubating. But I thought I had to come online. But there's no voice. I'm sorry. Can you hear me? Can you hear the voice now? Yeah, good afternoon. Can you hear the voice now? You need to get here from the UK. You're most welcome. All right, so I'm going to quickly go through this patient that we did because it was a very interesting case. So this is what we started with, and you can see that chin overly projected, especially in the horizontal dimension. In the local English colloquium, you probably want to call that as a witch's chin on this guy, right? So now we did our scans. We planned everything out. I'm going to take you through what we did in the time frame. That's, you see, today 12:55 p.m. Wow, I've never been to Chad, Jason. I love traveling, so maybe sometime in the future. I'll get some French classes too before I get there. All right, so we're going back to this patient now. And this is the chin, and this was at 12:55 p.m. That's like an hour and 5 minutes before. Now we're going to show you one by one. That's me making the incision at 1, 2. And then that's the exposure. We have the chin kind of exposed at 120. At 124, you can see the chin that's clearly marked. Planning is done. Oh yes, Joy, yeah, you're welcome to come over to Nagercoil. Nice to see you too, Bhavika. So if you have a question pertaining to this, sorry, please put this up because I think it's showing something else. I'm sorry. All right, so that was what the plan was, and this was at 124, as you can see in the timing. And I'm going to show you ahead. Made the osteotomy, so we had to reduce this projection that he had, sharp angle. It was very, very awkward. We reduced that. We increased the height, and this is the planning. Get back. Oh yeah, there we go. So that's the time for you on the side, 141, and that's what we ended up with. I'm going to show you a little bit more enlarged. So you see that in this case we've just used two hole plates, and we've left a gap in between because we want vertical augmentation, and this vertical augmentation, all the gap is going to get filled up with bone. Yeah, we're going to be in Bangalore soon, but guys, for the moment we're here. Can be just in one place at one time, unfortunately. So this is immediately when we fixed it, and I'm going to show you a video just after we finished. You can go through this. So this is going to show you how we drape the chin. After that, Vishal, nice to know. Yeah, that you're welcome to come here too. Angle osteoplasty is safe as long as you do it well, just like how genioplasty is safe if you do it well. I think everything is safe. These are all safe surgical procedures that have been done for years on end, maybe 5 decades, maybe 4 decades, a lot of time. Okay, so that you can see me trying to look at how the chin was after we redrape it, and that you can see the improvement straight away. You remember I showed you the before, just that people who don't remember, that was the before. So you can see how the pointy over projected chin was contoured. You see a lot of heart shapes there. Thank you. But then if you have any questions related to this case, I'm more than willing to answer. We would probably, I'm just trying this for the first time on Instagram. Do let me know if it was useful, because if it was, and then we're probably going to come on live every now and then. We have some time like this just after we finish a case, or probably just when we're starting, or maybe even during. All right, so you know what? If you guys have any questions relating to the timings, surgery details, and everything, you're more than welcome to not drop a message here. That's of course all right as well. But to know the details, you can do WhatsApp me, WhatsApp us rather. I will send you the number if you ask. 944318280. Yes, Jason, he does have a strong personality, but you know, this is like a very, very overly projected chin, because you know this angle is high, it's too pointy, it's just coming up too much. So even though a large chin is nice for a guy, but it's not so nice when it's in this particular angle. So what we've done now is I've not made it into a small tiny teeny weeny chin. What we've basically done is to make it more suitable, more proportional for him. Well, if you want to correct the occlusion, then obviously I need to go for BSSO. But in this case, since we're not doing anything with the occlusion, so we don't need to do the BSSO. Yes, Matthew, we will try to do this as often as we can. And do drop in your feedbacks. And take care. And bye-bye, I got to get my lunch now, though it's a bit late, because we have our next case starting in about 15 minutes. You can see all these guys were there behind, they've all left. So by the time they're back, I got to be back as well. Yes, Amchi Mumbai. We'll see you soon everywhere. Bye bye, and God bless and take care. How do I end this? Okay, I ended it.